Hi, good evening, friends. I'm Dr. Mahesh Nair, and I'm here back with a YouTube live session this time. And the topic for this time is facelift. I know it's a very extensive topic. Let me introduce myself first. I'm Dr. Mahesh Nair, cosmetic plastic surgeon from Nepantak Aesthetics, Panampally Nagar, Cochin. And today we would like to discuss the topic of facelift. Yeah, I know it's a very extensive topic, and one second, let me just get rid of this fan. Yeah, so it's a very extensive topic, and we will try to cover it up in parts, wherein we touch first the superficial aspects, then overview as to how what a facelift is all about and what it can do for you, how it will benefit you, and things like that. And then we'll delve into the technicalities as to which facelift is for you and how to go about that. So in this part one, I would like to one second. Screen. Yes. This is better. I hope my voice is being heard well. Yes. So coming to what is a facelift? So a facelift is basically a procedure wherein it's a facial rejuvenation procedure. It is the most invasive surgical procedure that a plastic surgeon can, or a cosmetic plastic surgeon can undertake to rejuvenate your face. It basically means lifting or restoring your face to its former glory. I can say, yeah, to its former glory. And we do tend to volumize it, or make it look more rejuvenated, more refreshed, basically using this surgical modality. So it involves the lifting of your facial skin, not only of your skin but of the underlying tissues as well. So all this fat and the subcutaneous tissue and the muscle and all, which has deflated or gone down with time, basically is lifted up, and it is made to what I can say, go back to its original shape and form where it was, and it overcomes the sag which has been induced over all these years with gravity, with sun damage, with a lot of other factors that have affected your skin and musculature, and that's how we rejuvenate your face. So that is a facelift. The scientific terminology is of course called rhytidectomy. Rhytids meaning lines and wrinkles on your face. So a facelift basically tends to remove those wrinkles and lines from your face. So that's what a facelift is all about. And along with the facelift, you usually combine the neck lift, because face and the neck are generally one unit. So when I see a particular face, I also look at the neck, how young the neck looks, because neck is usually the first region of the face, not of the face, but of this whole complex where your telltale signs of aging do come into perspective. Like you start developing lines and wrinkles and maybe these platysmal bands kind of on your neck. Sometimes they are here, sometimes they are here, and before your face looks older, your neck actually starts looking older. So that is one thing that one needs to what I can say, look into when you're considering a face or a neck lift. So there's a very basic simple test, what we call as the mirror test, which we undertake to find out exactly whether you are a good candidate for facelift or not, and whether you need a neck lift, which you yourself can do. In the sense, all you need is a mirror. You need to just look into the mirror and see for yourself whether these lines have become more prominent or not. The nasolabial folds, what we call. Then, are your brows sagging? Let me go from top to bottom. That will help you understand better how to see for signs of aging in your face. I know it's very difficult because you see your face every day, but for someone who sees you after a couple of years or months, generally tells very easily whether you look younger, you look older. Of course, losing a bit of facial fat naturally, like with exercising, regular exercising, diet control, and all, is a healthy way of looking younger for a longer period of time, of course. But should not deflate so much also that you start looking older sooner. So that's one thing that you need to be careful with. And so the mirror test, basically you need to just look in the mirror and see for yourself whether your brows have started drooping down, whether you have your upper eyelids have started developing folds or creases or something like that. Then your nasolabial folds, your under eyes, whether you have started getting bags, whether it is sagging, that can be easily found out. Your cheeks, earlier your malar prominences or your cheek prominences were here. Now have they subluxated, or have they gone down? Have they moved down because of the influence of gravity? Has your jawline definition got lost over a period of time? Have you started getting jowls over here, that is pouches of fat and soft tissue over here? And is your neck becoming more and more lax? Are you losing this angle, the cervicomental angle, what we call the neck and the jawline angle, the neck jaw angle? Are you losing it? Are you gaining a lot of fat and soft tissue over here? Most of my clients initially come with that complaint that, doctor, I've started getting fat over here, and this angle is all blunted, and my neck looks like a turkey neck. It looks big, and it makes me look older. So that's one of the first and earliest signs where your neck starts showing signs of aging. And then of course the face. So face sags, and you tend to look more older sooner. So this mirror test generally helps you analyze that whether your signs of aging need a particular modality of treatment or not. So you generally undertake a facelift as a last resort, but that is not how the modern cosmetic domain generally goes. So it's like you may be tired of doing fillers, botox, threads and all, and then finally you reach a facelift, which brings me to another question which is commonly asked: doctor, what is the best age to go in for a facelift? Now of course you don't go in for a facelift at the age of 18, that's a given. But we have done facelifts and neck lift for someone as young as say 40 in their 40s, starting with 40, 42, and to someone who's 66 to 68, so 70. So roughly, those age groups, there's no one barred from this age group as such. It all depends upon your skin laxity, your soft tissues, how they have gone down with time, and how gracefully you have aged. Normally speaking, Indians do age very gracefully, I would say, because our dermis is thick, so we don't get those lot of marionette grooves, nasolabial folds, lines. Our skin doesn't wrinkle that bad, and so we tend to postpone a facelift almost indefinitely, and we're at the fag end of our life, and then we think that, oh, why do I need a facelift now? It's not about that. There's a concept wherein if you want to look young for a longer time, then you get these kind of treatments done sooner. Like, it's just like how you go in for a filler or a fat graft or a thread or botox at the drop of a hat. I mean, not everybody does that, but many people, they do get into all these things at an earlier age. And what that only does is makes the situation more complex for the surgeon who's going to operate you later, because all these foreign elements in your skin, in your subcute, basically are going to affect our planes of dissection and will finally affect the outcome of the result. So one has to be very, what I can say, careful with that. I hope my voice is audible. Let me just get this a bit closer. Maybe that will help. Yeah. So where was I? Yeah. So fillers, botox, threads, face tight, neck tight, all these non-surgical modalities. I'm not saying they are bad. I'm not saying that they don't help. They do help, but there's a limit to what they can help with. Beyond a particular time, beyond your when the skin is really lax and you have deflated, it's not just soft tissue deflation. Even your bones, they undergo changes with time. Your bones tend to get resorbed. Your malar cheekbones go down, your eye sockets hollow out. So it's not just the soft tissue that leads to that undergoes aging. Even the bones undergo aging. Now surgically, we have not been able to devise any treatment for reversing the bone age. That is, we add bones, we make your sockets narrow again and things like that. So we try to camouflage it with the existing soft tissue and maybe adding. Now the new trick up our sleeve is using your own fat, that is fat grafting. So fat grafting has helped us immensely in volumizing your tissues. It's just like a filler, but it's a natural product, and it works even better than the filler, I would say. Lasts longer for sure. So facelift combined with fat grafting and neck lift and all, of course, do give you phenomenal results, I would say. They make you look younger by, say, a decade, but you won't look, of course, like you're 20 years old. You don't need to compete with your children. You need to look your age, but you need to look on the younger spectrum of your age. That's why that's what I always counsel my patients. You're not going to look really, really like a kid, but you're going to look your age in a very age appropriate manner. So you want to age gracefully. That's what matters. So that's why you need a facelift, even maybe at an early age. So don't shy away from a facelift or something. It is not a surgery that is a very gross or very magnanimous or something like that, which you will be bogged down with. That, oh my God, I'm undergoing a facelift now. What is going to happen? My face is all going to get distorted. No, nothing of that sort happens. It's just another cosmetic surgery which helps you get the desired result and believe you me, it gives you good results. I mean, nothing else beats a facelift as compared to any other surgery or any non-surgical modality in the market available right now. Whether you do thermage, you do HIFU, you do face tight, you do radio frequency, you do micro needling, you do fillers, Botox threads, put all of these together and put facelift on one side. There's nothing that compares to a facelift. So do you need a facelift? I think I answered that. What bothers you? See in the mirror and you can decide. How do you plan a facelift? Now, this is very important because most of my clients keep wondering that, doctor, I need a facelift. So how much of leave do I need? And how am I going to go about this? So facelift, it is not that you're going to need a tummy tuck like leave of say 4 weeks and all. Trust me, facelift edema and all comes down very well in 2 weeks. In 2 weeks' time, 2 to 3 weeks maximum, you're socially presentable. What that means is, suppose you have a function, you don't come to me 1 month before your function and tell I need a facelift. Facelift is to be planned roughly 2 months or something, or say 3 months before your function or something, whatever that you need to, go in for, because the face takes about 3 months in total to come down to 100% of its normal shape and size and dimensions and functionality for you to be socially presentable to that level. Now, if you want to go to work after your facelift and all, yes, definitely that's possible. After 2 weeks, the stigmata of facelift, that is the brow bruising, the edema and all, do very well settle down by then. And with our modern day techniques, it does come down pretty soon. We have got a lot of tricks up our sleeve to bring down the swelling faster, and it helps you regain your confidence at a much sooner pace. So planning a facelift is very simple. You can either schedule a video consultation with me, or you can come down and meet us. And in your vacation time or in your holiday time, we will help you plan this entire procedure, be it with a neck lift, a facelift, or any combination of surgery, so that you get the most of your vacation. At the same time, you undergo the best possible surgery for your face and gift yourself a facelift. So I'm making it sound too rosy, I know, but trust me, the results are that phenomenal. Very soon, I'm just waiting for a few results to come out, and soon you'll see on Instagram. Those will be getting published on my channel, Dr. Mahesh Naya. So you'll be able to see fresh, deep plane facelift results. So one is planning a facelift. You need to consult us so that we can help you plan one. And what are the types of facelift? Now, this generally bogs down plastic surgeons more than our clients, our patients, because there are numerous types of facelifts available. Scientifically speaking, there is the SMAS facelift, the max facelift, minimum access cranial suspension, what we have learned from the gurus in Belgium. So there is max facelift. There are different types of SMAS facelift. SMAS is the subcutaneous musculo-aponeurotic layer of the skin, which is basically the superficial facial layer of the skin, which also engulfs your facial musculature. And hence, when we lift it, we lift the entire face up and not just the skin. So it is not a skin alone lift. It is a lift which involves all your muscles, all your soft tissues together. So that's why you look younger for a longer time, say about 8 to 10 years. That's what the effect. That's how the effect of a facelift lasts, roughly 8 to 10 years. So roughly a decade, you can say. And what else was this? Yeah, types of facelift. So that you best leave to your surgeon to decide whether he wants a SMAS plication, SMASectomy, high SMAS facelift, or whether he wants a deep plane facelift or an extensive deep plane facelift. So depending on the facial architecture, whether you have a thick tissue or thin tissue, whether you have a lot of fat, whether you're going to need submental work, that is work in the chin and the jawline area, what all are you going to need? There are numerous approaches over here. So choose your surgeon wisely. Go to a person who has done these things before and who has experience in facelifts and who has the knowledge about it. So that will definitely help you decide what kind of facelift you need to go in for. And the scar, yeah, many are mostly afraid of the scar. Don't be. It's a very simple thing. You go in from here inside in this line behind the ear. Nowadays, we don't go all the way behind the ear into the hairline. Very few cases we need that, because our techniques are such that we manage with minimal incisions. So from here, we begin, we just go till here. That is till the ear lobule behind. That much is enough. So your neck, your face, everything gets addressed in this, and the line gets hidden right at the junction of your face and the neck, such that it is not visible to a common man's eye. If a plastic surgeon sees, well, yes, he may be able to diagnose that you have got a facelift done, but more or less, the techniques have evolved so much that scars are not really a problem in facelift anymore. Trust me on this. So Should you be afraid of one? I believe not. Definitely not. If you are in experienced hands, if you are in the hands of a board certified cosmetic plastic surgeon, definitely not, because we know the intricacies of a facelift, the nuances, what can go wrong, and how to rectify it. That also is known by us. So you shouldn't be afraid of one. Definitely, facelift does come with its set of complications. I'm not saying no. There are some sinister complications also, like facial nerve paralysis, more or less, which 90% of the times is temporary. It may last for a couple of weeks and then go away, because no surgeon is that blind to go and cut a nerve unless it is so anatomically aberrant that it's in a different field altogether, and it's not in our normal course of anatomy. It's not following its normal course. So definitely, the most dreaded complication in facelift is a hematoma, that is a blood clot which can get collected under the skin and tissues, which generally we tend to pick up very soon, because we are always on an alert post face. That's why I never plan a facelift before I go for a conference or I go for a vacation. Facelifts are generally done when you're at peace of mind and you are at your best. I mean, you as in the patient, as well as me, the surgeon, we are both at our best. And I'm there around to take care and to look after you, to monitor your progress. That is very, very important. Why is this cam? Yeah. 1 second. Why is sorry? Yes. Okay. So I'm sorry. The other camera which I have over here was not somehow activated, and I'm using the MacBook camera itself. So not an issue. So what was I saying? Yeah, should you be afraid of one? No, definitely not. But make sure your surgeon is there around to take care of you in case of, hematoma is the only one complication that we are afraid of. Rest everything is fine, which we generally, I've never seen one in many of my cases. So it's usually an okay thing. You don't have to worry about that. The most important thing, doctor, what all can I combine with a facelift? Now, I really wouldn't combine a rhinoplasty or a nose job with a facelift. Both are extensive procedures. Facelift takes around 5-6 hours. Nose job takes around 3 to 4 hours. Combine that, and you're like whole day in the operation theater. And both are surgeries which require high precision, high amount of attention. So we don't generally, at least I don't combine these two procedures together. Yes, what I combine with a facelift is a neck lift. These are given because this is what I consider is one subunit. So it helps you rejuvenate your entire face and neck together. So that is one thing that I usually combine. What I can add with this is a blepharoplasty, upper eyelid surgery, a brow lift that can be added, so that the sagging brows are taken care of. You also add facial fat grafting to select regions such as the malar region if you're that deflated. Generally, with the deep plane facelift, what we do, we tend to elevate this region along with its fat in total, so that you don't have to add fat anywhere. You don't we nowadays seldom do the max lift and the superficial procedures unless the smash is that light. If the smash is very light, we go in for that. Otherwise, in normally the Middle Eastern and Indian settings where this tissue is usually heavy, we do not do max lift anymore. We do a deep plane facelift because that is what is seen to give really phenomenal results, especially in the neck. And trust me, if a person comes for facelift, if a person comes for facelift, it is more commonly seen that after the facelift, they focus on the neck. That, oh my God, doctor, see, there are still some lines, left over here. So that's why our attempt is to do a fantastic neck lift with a facelift, because a few lines over here are sometimes tolerable, but the neck should look its part. It's generally one thing that denotes youthfulness, like a youthful neck, which adds to the face. This is generally not known by lay public. They feel that, oh, the face is of prominent importance. No, of equal importance is the neck. So that's what we do. So face and the neck are taken together. You add a blepharoplasty, that is upper eyelid surgery, lower eyelid surgery, maybe to take out eye bags if needed. That can be done. Lip lift. This is a very commonly done procedure these days with the facelift. So you decrease the height of this lip. Now, this is normally seen in my Caucasian population of patients where, they as they age, the lips undergo deflation. That is, they lose tissue and they become more thinner, and this height increases. In the Indian population, somehow it is not that frequently seen. It is less commonly seen as compared to the Western population. So lip lift can be combined. Then you have what else is there? You have facelift, neck lift, brow lift, lip lift. Facial fat grafting, which I already mentioned, that is very much done with any kind of facelift. All these lines and all can be addressed with microfat, nanofat. You have sharp needle injection of fat, SNI, of the sniff procedure, what we call. So all these basically are ancillary procedures that can add. Of course, later we can do a carbon dioxide laser, a CO2 laser, basically to resurface the skin and to make it look even more rejuvenated. But that is again, it depends on the skin type. If we feel that this skin has taken enough insult with the facelift and we add a laser after that, it might do more harm than good. So we have to judiciously weigh what we are doing when we are doing. And what after a facelift? Now, this is a very common question. Doctor, how many weeks do I need a rest for? And when can I fly back and things like that? Because I've noticed this invariably, most of my facelift clients are from out and they have to go back. So when they have to go back, the first question is, when can I go back? And then that is literally a perplexing question because I cannot exactly predict who's going to settle when. Okay, some may be a smoker, some, and nowadays the other trend is they vape, and then they tell the doctor, I don't smoke, I just vape. I said like, oh wow, look, it's going to affect your, your repair mechanisms one way or the other. So be very careful with that. Do tell us everything, what you're doing, what you're taking, what medicines you're taking, because generally facelift is done in the elderly populations who are having some or the other kind of morbidity, and you may tend to have diabetes, blood pressure, or you may be on anti-anxiety agents, antidepressants, whatever it is. Please do let us know beforehand, because then we can work our way around for your safety. Safety is paramount, that is to be taken care of. So what I say is, normally post facelift, give me 2 weeks, because we need at least 3 visits. So one more thing, we do use drains in facelift, which are like a very narrow drains inside that are kept till the neck, which we remove the next day, because after 24 hours is when we discharge you. So we remove the drains and then we send you home. Then I need to see you one day later again to change the dressings. We give cold compression in a very different way, which I can explain you once when you're in here for a consultation. It's very unique, frankly. So that cold compression and all works really well. So the edema is less, the swelling is less, everything is less. Even the bruising, I have practically not seen any kind of bruising in a deep plane facelift which I have done so far. So it really makes a lot of difference, the technique what you use. And so one visit is at 48 hours, then at 1 week, and at 2 weeks, and that's all that I need, because at 1 week I get rid of these stitches for you. At 2 weeks, if there has been a lip lift or something which is more intricately done, that those two stitches are also removed out by 10 days. So I need basically 2 or 3 visits after a facelift, and then you're free. So they ask, like, can I fly out at 2 weeks? Now, well, if you have a long haul flight, something from here to the UK or to Canada or something like that, then I would say definitely give it at least 3 weeks, before you fly out, because cabin pressure varies. If you're in a compressed chamber of air and you're flying at a different altitude for a longer period of time, you tend to develop swelling and all, which will take a longer period of time to settle down. So that's why give yourself sufficient time to recover before you endeavor on a long haul flight. Okay, if you're going to go from here to Dubai, which is a short flight, say like 3 hours, definitely 2 weeks are more than enough, and you can definitely fly out. So it's not that a facelift is going to bog you down and, doctor, I would prefer fillers right now and it's going to save me effort. No, it's not going to do anything great to you. In fact, it's just going to destroy your planes, which would have been very ideal for us to give you a good result with a facelift. So don't be scared of a facelift. This video was primarily to just prime you about what a facelift is. Subsequent videos will definitely delve more in depth on this topic as to what kind of facelift I prefer. How do I go about it? When I mean a deep plane, how do we kind of do it? Of course, not the technical mumbo jumbo. Plus, we will show you some results online itself over here, and they'll be posted on Instagram soon enough, Instagram and Facebook. So do keep in touch. And if you have any questions pertaining to the facelift per se, do feel free to ask in the comment section or get in touch with us on our phone numbers mentioned on Google and everywhere else. So thank you all for your patient listening, and do get in touch with us if you have any questions. Thank you once again.